Hi, my name is Wendy White, and we're going to consider the nurse and the individual and enduring collaboration. To do that, we'll set the scene, look at this relationship between the nurse and the individual, caring behaviours, and trust and collaboration. On International Ethics Day in 2021, the International Council of Nursing launched an updated code of ethics. It identified that the number one primary professional responsibility of the nurse was to their patients or to other people requiring care or services. That included patients, family, community, and populations in any practice setting. And how that relates to us in skin and wound care is the vulnerability of those that we're working with, those at risk of injury or harm, those who are wounded, their family and loved ones, and the carer and representatives. The ICN in 2021 described nursing as rooted in traditions and practices of equality and inclusion with appreciation and respect for diversity. These are enduring principles of nursing practice. And when we consider our topic for today, the nurse and the individual and enduring collaboration, how do we get to that point of partnership and working together to accomplish mutually agreed goals? What would be the steps? Well, then our relationship is of key relevance. It's been identified that relationships matter, and when we want to engage and work together as an individual and nurse, we need to establish and build that relationship. It is seen as foundational to nursing to be effective and efficient. It's this interaction between two people. The nurse is just fulfilling their roles with skills and knowledge, and it's in such a way that we can help people. This can then lead to positive clinician and patient experiences and also transform and enrich a person's life. It's been 40 years now that caring has been considered synonymous and fundamental to nursing practice and theory. It's been described as core, the essence, the cornerstone, the heart of nursing, and it really unifies us around the globe as nurses. To try to meet this everyday care challenge is important because Professor Jean Watson stated, "Caring may occur without curing, but curing cannot occur without caring." So we do need to address through our caring these two key components and meet their physical and technical needs as well as their psychosocial and emotional needs. The perception of being caring will be that we are respectful and present in the moment, providing words of encouragement and reassurance to provide hope, and that there'll be evidence of mutual problem sharing and tailoring care for individuals. This capacity to care means that we'll demonstrate empathy and compassion, not only see their needs, but act to meet their needs. And to advocate on their behalf is one of those key components. If we can demonstrate this capacity to care and advocate, it can only go a long way to building trust. Trust is this interpersonal and essential element of every patient and nurse relationship, whether a brief or a long-term interaction. It's been deemed as relational and process. And if we're meeting their needs, being respectful, attentive of time, providing continuity of care, and recognizing that first impressions count, that goes a long way to developing these perceptions of trust. And the attributes will be demonstrated in effective communication, a connectiveness, and reciprocity where we're sharing mutual information to benefit both parties. This really opens the door. This relationship built in trust, this rapport, not only helps the patient adapt and feel safe and secure, but it provides a relationship that promotes engagement, and it just opens the door and opportunity for collaboration. So our behaviours and our values as nurses really matter. The actions and attitudes, what we do and the way we do it, influences the feeling or the perception of trust by the individual. The role of the nurse is to provide evidence-informed and patient-centered or person-centered care. This is best practice in action. So how can we as nurses expect an enduring collaboration with individuals without the provision of care, the heart of nursing? Because without care, there's no trust. With no trust, there's no relationship. Without relationships, there can be a lack of willingness for individuals to engage and collaborate. We may want them to, we may expect them to, but it really does start with us. So again, in the words of Jean Watson, maybe this one moment with this one person is the very reason we're here on the earth at this time. Thank you.